You've probably heard that one of those vaccines, and there are more than one, there are several that are moving along at various paces. One of them will enter phase 3 study in July. This is one that has already shown in preliminary studies some very favorable response in the animal models that were developed. There will be others that will follow 1 month, 2 months, 3 months later. Although you can never guarantee at all the safety and efficacy of a vaccine until you actually test it in the field, we feel cautiously optimistic based on the concerted effort and the fact that we are taking financial risks, not risks to safety, not risks to the integrity of the science, but financial risks to be able to be ahead of the game so that when, and I believe it will be when and not if, we get favorable candidates with good results, we will be able to make them available to the American public, as I said to this committee months ago, within a year from when we started, which would put us at the end of this calendar year and the beginning of 2021. It really is a mixed bag. We have a very large country, very heterogeneous, major differences, for example, between the New York metropolitan area and Casper, Wyoming. If you look at how we've been hit badly. I mean, anybody who looks at the numbers, we've had now over 120,000 deaths and we've had 2.5 million infections. So it's a serious situation. In some respects, we've done very well. Right now, for example, the New York metropolitan area, which has been hit extraordinarily hard, has done very well in bringing the cases down and using the guidelines that we have very carefully put together. Bottom line, Mr. Chairman, it's a mixed bag. Some good and some now we have a problem with.
Does it make sense that to safely open our economy, we should be limiting the number of tests rather than ensuring that anyone who needs a test can get one?
I know for sure, but to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
Has President Trump ever directed you to slow down testing for COVID-19 in the United States? Dr. Redfield?
No.
No, sir.
No, Congressman.
Thank you.
To date, the nation has performed over 27 million COVID-19 tests, now averaging about 500,000 tests per day. Even without any major technical advances, I estimate the nation will have the capacity to perform between 40 to 50 million tests per month by fall.